ocular motor problems are so common after sports concussions, and it's not very surprising to know why. It's because a large part of the brain is actually devoted to vision. There's your eyes, there's the optic nerves that go from, your retina on the back to the vision processing centers in the brain. There's the entire optic radiata around that covers like 20% of your occiput over here. But apart from that, ocular motor muscles, those extraocular muscles, they're also so important for neck. Sorry, not neck, for vision. Because if you're not looking at what you think you're looking at, your vision is going to be pretty bad. But apart from that, vision interpretation, which is actually a cognitive thing, which is more affiliated with the frontal part of your cortex. If your brain can't interpret what it's saying, then you're also going to have vision issues. And then, like, another cause of like vision issues in patients with concussions is pupil sizes. So a lot of you people know that the autonomic nervous system might be blunted after a concussion, but the thing is, your pupils are actually, like very, very dependent on like the autonomic nervous system to controlling how much light is entering. So if their autonomic nervous system is blurred, too much light starts entering their eyes, and that gives them blurry vision, as well as sometimes it gives like sensitivity to light. So it's not surprising that ocular motor problems are very, very common after a concussion. Now, the best way to diagnose or technically screen for ocular motor problems are these screening or assessment protocols. So, like I mentioned before, the best, in my opinion, is the vestibular ocular motor screen, because this is so well published, and it is from researchers at the University of Pittsburgh, specifically Ann Muka, Mickey Collins, Anthony Contos. But apart from the VOMs, there's also the modified version of the VOMs, which is part of the SCOTE. So basically, in the other ones, they just like shortened it down a bit. Side by side, even UPenn has their own ocular motor and vestibular assessment protocol called the VVE. And also, once upon a time, I also had a ocular motor and vestibular assessment protocol, but the VOMs is so much more popular than that. But as you can see in almost all of these assessment protocols, the ocular motions are very, very similar. People want to know, are you able to track a moving object, okay, with your eyes? So are your eyes like smoothly able to pursue like an object? The second thing is horizontal saccades. Are you able to look right, left, right, left, right, left, and like focus on an object without any symptoms? The other component is the horizontal BOR. So with your eyes fixed on a location, you move left to right. So you're able to maintain fixation while motion. And then near point convergence. And if someone is coming closer, if an object is coming closer, are your eyes able to like converge? So there are other things that people can also look for, like, visual motion sensitivity is definitely something that's in the VOMs as well as the modified VOMs. And then the visual vestibular examination. So the people at Children's Hospital of Philadelphia at UPenn, they're a lot more interested in accommodation. But as you can see, a lot of these are very, very similar. But the thing is, the VOMs is only a diagnostic tool or a screening tool. It can only tell you if there are ocular motor issues, yes or no. Treatment of those ocular motor issues is a very different story. So standard ocular motor rehabilitation is called, ocular motor rehabilitation exercises. So 50 to 70% of ocular motor problems will recover on their own in the first 2 to 3 weeks with basic management. However, it takes approximately 2 to 3 weeks to even make an appointment with our physical therapist who is experienced in ocular motor rehabilitation. Unfortunately, we only have one. So that's why, and he's always like booked. So that's why, like there are times. So even if we see something on the first week or a second week, it is pointless to give them a referral to go to see our physical therapist if by the time they actually make their appointment, there's a high chance, like a 70% chance, that they're going to be recovered. So in this situation, we do not want to utilize too much healthcare or, waste all of those things. So in this, we start with basic self-guided exercises first. I'm going to explain this on the next screen. And then we refer to a physical therapist if the patient has not recovered by 4 weeks. So here are the exact instructions for our eye rehabilitation exercises. So the headquarters health platform, they also have, like very similar exercises. They've actually utilized this as the template, and they've made videos. And then our physical therapists, as well as our athletic trainers, have actually reviewed those videos for content accuracy. So I'm very confident. So either you can use this or you can utilize other things. So first you do the test, like for example, you do the VOMs. There's abnormal smooth pursuits and VOR. Their near point convergence is fine. The vertical saccades is fine. So in this situation, I will just circle this smooth pursuits, circle this VOR, explain to my patients how to do these exercises, and just let them do it at home. Because most of these exercises, horizontal saccades, VOR, and PC, these are just the first line, the initial steps of physical therapy management. And, they're you can do them with just post-it notes, pens, or, even if you have your fingers as like targets, you can do a lot of these exercises. We recommend that patients do it for like 1 to 2 minutes a day and try to do them like twice a day, once in the morning, once in the evening. And there are detailed instructions on when to start and how to progress. So out of all of these, only smooth pursuits is something that I feel like patients cannot do on their own. So in this, there are actually lots of free resources available online, especially YouTube. So you could even in our handouts, we actually tell the patient, search for smooth pursuits retraining on YouTube, and then select the videos that your clinician has recommended. Because I feel like these exercises are so simple, and if we can make them more and more available to people, then there's a higher chance that it can actually cause benefit on a large scale. And because I've actually tested this out in a trial, and I found that if by giving these instructions directly to patients within the first, 1 month of injury, we can actually reduce the number of impairments at 4 weeks by approximately 50%. So I'm going to explain this over here. So we had 2 arms, our standard care arms. So these patients came, they did the treadmill test, they were on their initial assessment, they did the VOMs, they did the whole scope, they were diagnosed with a concussion. And then the standard care arm, we just told them to do our aerobic exercise protocol and our neck stretches and everything, whatever our standard protocol was. But we did not tell them to do any specific ocular motor rehabilitation exercises. Whereas our experimental arm, we told them to do these ocular motor exercises on top of their aerobic exercises. So there were absolutely, so I matched I matched patients based on the exact number of ocular motor issues they had. So the patients who had more than 3 normal ocular motor findings, so clearly the ones who will take longer to recover and will need ocular motor physical therapy. So these are only those patients, they're very, very matched on every single ocular motor finding. So we saw them at the first stage. Again, this is that Kaplan-Meier survival graph. The black line is the standard care arm. So as we definitely, if someone has 3 or more ocular motor abnormalities, they're not recovering in that first week. So when from the first week onwards, someone starts to recover, this number starts going down. And by the 30-day time point, approximately 50% of these patients still have ocular motor issues. And these are the people that we referred to for physical therapy, for specifically ocular motor physical therapy. So aerobic exercise alone also, decreases some ocular motor things, but you have to remember that while someone's doing aerobic exercise, technically they are retraining some parts of, their eyes, they're jogging, they're viewing, they're scanning. So maybe it might have a benefit. We don't really know. But by adding these additional self-guided ocular motor rehabilitation exercises, we actually were able to decrease that number by like 50% even further. So for example, if 100 patients, out of 100 patients in this arm, 50%, would have been referred for ocular motor therapy. But if we were able to reduce that number by another like 25%, then we can actually decrease the overall burden of concussion care as a whole. So again, those ocular motor exercises, in my opinion, they are so simple, they're so straightforward, and we have shown that they are safe to perform and prescribed by medical assistants. So people who aren't even like clinicians. So if medical assistants can do this, then you as athletic trainers are clearly well a lot more qualified to do this. And then, oh, thank God. Okay, this is the end of my presentation. So I did talk about some important resources. So all of them are over here. So this presentation is slightly different than the one that I uploaded because the ones I uploaded didn't have the important resources. So I'm going to give this version to EBP and, maybe they can update it. So all of our exercise test materials, aerobic exercise testing, the handouts, remember concussion.ubnd.com. If you want sport-specific return to play protocols, so this is open access. So open access means that this is free for you guys to download. They have 10 appendices, cheerleading, gymnastics, wrestling, football, soccer, they have a lot of these. So balance rehabilitation. So these are the resources from UPMC. Unfortunately, this is not open access, but very few people know this. You can actually just email the first author, just ask them if they would like to share it with you. 99% of the times, researchers will be very happy to send you their stuff. And then finally, the self-guided eye exercise paper. Again, this is open access. And the one-pager eye exercise handout is actually one of the forms in it. So you can just directly download it from there. And then if you want to know a little bit more details about aerobic exercise prescriptions, we have a phenomenal practical management paper that explains it step by step. All right. So that's scenario of the 15-year-old female soccer player. So we saw her. Her injury was only 3 days ago. Pretty early in the phase, and observed. So even though she is reporting a lot of symptoms, she is reporting some neck tenderness on palpation, but there's no loss or range of motion. So I think, in my opinion, this is like a mild neck problem, and this is going to be managed by an athletic trainer. So in this situation, I will, our plan would be to return to school and social life as tolerated. Okay. So, and I would start an exercise program because I would start that exercise program because, she's still below the 180%. So specifically, I would instruct to start the target heart rate aerobic exercise program, and our athletic trainer will be the one who actually supervises that. And then side by side, I will also tell my athletic trainer to, manage the neck with, stretchings, exercises. I just let them make those decisions. They are the clinicians. And then finally, I will wait and to re-examine them next week and reassess the eyes and balance to see if these are recovering normally or not.